Hello, and we're live from World Headquarters of Mission Direct Primary Care in Omaha, Nebraska.
Yes, we are. It's Thursday. It's 12:15. We're keeping our New Year's resolution to be more regular and predictable with not only our pricing, but also our Facebook Lives.
That's right.
It's a silly joke. I'm Elizabeth Hallgren with Mission Direct Primary Care. Here in Omaha, we are a membership-based family medicine clinic. And you are?
Dr. John Hallgren, owner, operator, and chief medical officer, I guess.
All around smart dude.
MA, sometimes.
Yep.
Custodial service.
Yep.
Whatever needs done right now.
Yep. I'm the event planner and chief networker. So just wanted to hop on today. We were lucky enough and had a great weekend at the Keto Summit. I was able to be there on Friday. John was able to be there on Saturday and met a lot of great people. Of course, we have our door prize drawing because we like to arm people with what they need to have in their kind of medicine cabinet at home. So it's the blood pressure cuff, some first aid things and wound care things, and a thermometer that we'll be giving away kind of at the end of our talk today. But one of the common things that I heard, and I've heard this as I've networked with folks and met people in the community and then heard it when I was at the Keto Summit, is that the direct primary care model, when it's just laid out in its simplicity, seems almost too good to be true. And so people are kind of wondering what's the catch. Because I think healthcare has intentionally in some ways been made complicated to keep people reliant on insurance paid, the perception that you have to have insurance to pay for your care and to have access to a doctor.
Yep.
And because we're stripping that away, I think people are kind of skeptical. So I just wanted to talk today with you a little bit about the DPC, the direct primary care, which is DPC model, and whether or not it is too good to be true, and how it works and what people can expect.
Yeah. So definitely not too good to be true. There's 1,000 practices plus nationwide and growing pretty quickly. So just to recap what the model is, we are a flat monthly fee that pays for all the primary care that we offer in the clinic. So wellness, acute visits, chronic disease management procedures. It includes 24/7 access to us by phone, text, or email. It includes telehealth or virtual care. So if you're on vacation in Disney World and you don't want to spend half a day ruining your vacation seeing somebody, most of the stuff that we do can be done over the phone. So that's all included in the membership. We also include a small suite of labs, and we're always looking for the best cash prices when it's something that we don't do within the clinic. There's never any co-pays. There's never any per visit fees for the things that we do. And I think it's a really powerful way to restore the relationship that you need and access that you need to really manage your healthcare the best.
And from a business model, because that's my side of the house and my background, the reason it works is because of the subscription model.
Yep.
It's because patients are committing that financial monthly amount to their doctor, and then the doctor can then build out and service the number of patients he needs to cover his or her overhead based on that subscription model. And so that's why, that's why it works, is it's because of that mutual kind of agreement that it is valuable to me as a member to have a doctor that I know I can call and trust and knows me, and I'm willing to commit to that on a monthly basis, and then that doctor will commit to being available for me.
Correct.
And that's kind of the fundamental basis of it.
Yeah, and that model, so you don't need insurance to see us. We don't take insurance as payment. And because we are directly contracting with you as either the patient or the employer who's providing a benefit, we're always working directly for you. I don't care what an insurance company says. I don't care what the government says. I just do what I think is best for you medically. And as Elizabeth mentioned, that model allows for that, and that allows us to see you in a way that's most convenient for you, be that in person, discussing really in-depth things for a lot of time, be that a 2-minute visit to make sure you don't have an ear infection, or virtual care because it's more convenient for you for whatever reason.
Yep. So it really it does work, and it is a different way to think about healthcare, but we think it's the better way to think about healthcare. And it allows families and individuals to budget for their primary care. and in a real predictable way. So our family membership is $256 for a family of 4 monthly, and so you pay $200 for your cell phone bill in the family budget, and you pay $256 for your doctor bills. And most people, if they look back at what they paid out of pocket over the last 1 to 5 years for their doctor's visits, would find that they're actually paying less to commit to us in a membership model and getting better care, because it's your same doctor time and time again, and you're not wasting time in the waiting room or being diverted to urgent cares because nobody's available to see you or the next available provider. So that's where the value is really driven for consumers. So what's the catch? Are there any catches?
There really isn't any catch. We are very clear about what the scope of services we provide is, and we're very clear about what the price for those services is. And there's no catch up type stuff. If we do things that are going to be an additional cost for whatever reason, in our model, we don't upcharge you for things that we sell you out of the practice. That's labs, splints, those kinds of things. But
we just charge through the wholesale price, right?
Those are given at wholesale pricing, so I'm not incentivized to make any money off of selling you labs or other things other than our membership services. For those things that we do end up having to go outside the clinic for, we work really hard to find the best cash pay prices, and you're going to know that it's going to be an additional charge before we engage in it, and you're most likely going to know, if not exactly, at least a ballpark of what it's going to be, and we can help you prioritize if there's multiple things, what's the most important to get done quickest.
Right. And wait on things that can wait so that you can work it into your budget if that needs to happen too.
Yep.
I liked in that flu video that is circulating now because I boosted it, that you talked about that a rapid flu test doesn't really change or impact the way that you treat the flu.
Yeah.
So you can have that discussion about cost and still get the best clinical diagnosis and treatment plan.
Right. Yeah. So
without incurring the cost.
Yeah. Often you'll go into a clinic and they'll almost automatically run a rapid strep or a rapid flu test on you. And honestly, those tests rarely impact a decision because those decisions are largely clinical, meaning we look at you and say, hey, you've either got it or you don't, and we make our decisions based on that. Occasionally they'll help, but usually they don't. And so we don't order them automatically. And if we do order them, we say, hey, this might actually be one of those cases where this is helpful, and you know what the cost is going to be before we do that.
And so involving patients in that decision. Yeah. So are there any visit limits?
No visit limits. You can come in as often as you feel like you need to. Contact us in any manner that you feel like you need to.
And after hours is really as a service for if you are facing an urgent health need, we want you to call us, not go to an urgent care.
Right.
We don't want to refill your prescriptions after hours.
Yeah, you can send us a message. We just want to
right. Or answer a question about side effects unless it's making you physically ill. Those type of things will happen and be serviced during business hours. The after hours access is really for urgent stuff, right? Urgent stuff, right.
And basically, we feel like it would obviate the need for you to go to an urgent care.
Right. And there's a lot of value in that too.
Oh, yeah, hugely.
So, what else do you want to say about that?
I think that pretty much covers it.
I do too.
Like I said, our pricing is transparent. Our scope of practice is clearly delineated, and we feel like we offer really good value for what we do.
I do too. I agree, and I get it. Healthcare delivery has been so kind of obscure, and the pricing is really not transparent. So people are very leery, and we're just really wanting to talk folks through and help them understand that this is really a very clear and transparent transaction. And we're kicking out the intermediaries that complicate things and just having that transaction and that agreement being between